for wading through all that we have to go through.
So I'm Katie Bentley. I'm currently the Public Policy Coordinator for the Commonwealth Council on Developmental Disabilities. I came about this position from a lot of work as a mom, and so I really believe in the voice of family. I think it's very important. Just a little background on myself. A few years ago, my son and I went to Washington, and we testified before the Ways and Means Subcommittee, who wanted to cancel Social Security and therapies for children because children did need services. And so some folks from Philadelphia found us and brought us to DC, and a wonderful Congressman Lewis, he gave me his 5 minutes, and let me tell you, John Lewis. I actually got to see him when I was in DC again last week, which was great, and so he gave me his 5 minutes to talk about my son. And so that was a very huge time for children's advocacy in the nation, actually. So that was some work that I did, and then I didn't realize when one of the attorneys who I worked with said, "Would you write for a friend of mine?" And I said, "Sure, just have him contact me." She said, "This time you get to tell your mom's story. You know, my worries, my concerns. We had to pay $1,000 for seizure medicine a month, and you know what that was like." And so I got a phone call from Los Angeles, and it was Maria Shiver's office, and so I got to write for the Shriver Report. And so our life just kept going in that same direction, further and further away from the degree that I got at EKU. But I ended up also working, unfortunately, on the Restraint and Seclusion Regulation here in Kentucky because my son was abused in a Kentucky school. But he's very, very proud of that work. And if you ask him about anything he wants to tell you, the first thing he's going to say is, "I helped make a law for little kids." So he's really proud of it. So we're really proud of him because I asked him if I could tell his story, and he said sure. And initially I took an 8x10 of him, and then he asks me when we're going for the actual hearing, he says, "Mom, can I go?" And so he went to that hearing, so he got to be there. And he actually received the Gene Goswick Advocacy Award from Protection and Advocacy for his systemic change, because he actually got to, help make a law to protect other kids. And so Will's really proud of that, and I'm really proud of him. Yeah. And so our life really keeps rolling. So I'm really glad to be where I'm at. I have an opportunity to do really, really good work. I am in public policy. And so I want to tell you a little bit about the council. I think it's a very important agency that everybody should know about in our state. Just make sure I get this right here. So this is just a little bit about our mission. So to create systemic change in Kentucky that empowers individuals to achieve full citizenship and inclusion in the community through education, capacity building, and advocacy. So all of the council's work is about making real progress where people can actually see it in their lives. So it's there's lots of money that comes from the federal level down to Kentucky, and then it's all done. It goes out into project work. It's things that get done in the community. So just a little background on the DD network. That's the Developmental Disabilities Network. See, the council's just one part of that. So we have what's called our UCEDDs. Now that's the University Center for Excellence on Developmental Disabilities, and that is HDI. So if anybody's wondering, that's our Human Development Institute. We only have one in Kentucky. Some states have more than one. Ohio has several. I attended their program there called LEND, Leadership in Education and Development and Neurodevelopmental Disabilities. Kentucky doesn't have that yet. We've actually tried to get that, and hopefully we'll see that in the future, but it's a really, really good program. It's kind of like the graduate certificate program, but it's a little different because, I went to school for a year alongside medical professionals, and I taught them about family advocacy. So the things that I learned, that we've all learned, I said from the University of Life, they want to know that, and they can't get it in a textbook. Just can't get it there. So really, really, your life is very, very important, the things that you go through, and it really helps other people learn. Protection and advocacy, we all kind of know what they do, I think. So if you look at these three are sister agencies that all work together.
Some people might not know that they handle legal issues for individuals.
So if you have a question too, you can call Protection and Advocacy, and they'll give you just like they have disability advocates who can give you information. And sometimes it might be that you actually need legal representation and they'll assign someone to your case. But sometimes it's just that you have questions and you need to know directions to go in, and that's a really good place. Also, if you're having any issues, great place to make a phone call, because they will keep that information. So when they're going to the state and saying, we know that there's 40 people who are not getting services this month, or there's 400 people who have said that they've talked to this agency and they're being declined an opportunity to be on the wait list. If they don't have those numbers, they can't present those numbers. So I always encourage someone, if you're having any issues, call P&A, because they do take note of that information, and it's really helpful, because especially when people are starting to look at Michelle P. waiver services, because if you don't get your waiver services, like just an example, my son's services lapsed for 4 months. Didn't have services for 4 months. And so when you're getting to that 4-month mark, you're getting time to be kicked off the waiver. I don't know if everybody knows that. You're at that point of losing services. And so if they have that information, they can say, we have families who are at this point, and they can ask why. And then they look into it once the questions have been asked. But it's just really important place to leave a paper trail. So does anybody have any questions about this slide? I think these are places that you should know about, every one of them. Any parent in Kentucky who has a loved one with disability, they really need to know these three. Yes?
Do you have a paper?
I actually have several handouts here for you all, and I have the PowerPoint on there.
It's okay.
What do you want me to pass?
The first, all of them. You can give anybody all that information, whatever they want to have. So a developmental disability just means that it's before the age of 22. It can affect, if you look at the bottom, it can affect any of these 3 major life activities, like self-care, mobility, self-direction, your expressive language, receptive language learning, capacity for independent living, and self-sufficiency. It has to be that it's most likely to be indefinite, and then it has to attribute to their mental or physical impairment. So if you have a developmental disability, then we know that there's a lot of different waiver systems than if you just have some physical disability. Sometimes it works very differently in Kentucky. So the DD Act is the Developmental Disabilities Act, and the purpose statement is to assure that individuals with developmental disability and their families participate in the design and have access to culturally competent services, supports, and other assistance and opportunities that promote independence, productivity, integration, and inclusion in the community. So those 3 sister organizations are all really working toward this. So they each play a part. And I'm really happy to say that in Kentucky, we have a very strong DD network. And a few years ago, I was actually in Washington, and that was one of the comments that they made to me was, oh, you're so lucky, your DD network works great together. And we really do. We're working on some great collaborations right now. So as far as DD Act, the system always works on systemic change, advocacy, and capacity building. So a little further into the slide, you'll notice that those are the 3 areas that we have to focus our work on. So it has to be systemic change, it has to be advocacy, and it also would have to be in that capacity building. So these 3 areas carry over into our network. I'm not going to go over all that because it'll tell you a little more as we go through. So systems change. A lot of great programs are created, and they need funding. I guess you've all know, always trying to fund programs. So the programs need to promote independence, productivity, integration, and inclusion. And then under systems change, we also have public policy and advocacy, because that drives our systems is, you know, your voice. It really makes a huge difference. And I can absolutely say that because I've seen my family's voice make a change on the federal level and also on the state level. So I wholeheartedly believe your stories are very, very important, and you do really need to share them with your legislators and get to know them, and also it's encouragement to other families too. So programs that the council has worked on, you'll probably recognize this fellow in this Kentucky shirt, the peer support programs. So that's been a program that's the council has worked on for a few years. What we do is we fund the program. HDI has done it. But it's been a really great program. Are you all familiar with peer support, the peer support network? So, of course, Melanie is, because yeah. So this project, what they do is they take a student and then they pick other students who don't have any disability and they work with them. And it has gotten so great that the students are asking to keep carrying it over into the next grade. I mean, it's really good. They've had schools on top of schools sign up for it to the point that they actually couldn't take all the schools at one time. Yes.
Do you have to live in Washington?
No, it's actually all over the state. There's actually, they're not just in one area. Like, I don't know all the locations, but there's quite a few. And it started out mainly as a focus in, a lot of middle schools were doing it. And then those kids started saying, we want to take it to high school with us. So,
That's what I was looking for, the boys, like a big brother, and I couldn't get any information. I definitely would like information.
well, this is a great program, yes. And so, the idea is that these programs are able to stand alone after the council has funded them for so many years. And so I know that currently looking at trying to find a way to make sure that this program doesn't die, because it's really, really good. I actually attended a session and they were, that UK, HDI had put on, and they were talking, they had all these people in training in there, and they did a presentation and it was just a major cry. Because the kids who were with this student who had disability, they were starting to do things on the weekends. I mean, it was just not a school thing anymore. It was we're at the ball game, oh, he can hang out with us, we'll make sure he's okay. And they would help that student so that they could participate in things like other kids their age were doing. So it helped, I think, really be able to form some relationships. And then the students really just kind of ran with it. They really picked it up and took it off as their own project. It's really funny because one of the teachers was saying that one day he wasn't there. And so usually the students come check in, like they were doing games or something, and they would check in with the teacher and then go back into a room, they would all do the project. He wasn't there. So what did the students do? They went ahead and did their project that day. They went ahead and got everything they needed and went with the student and had their time. And he said he came back and he thought, oh, I'm sorry you all missed it. It's like, well, we didn't miss it. We went ahead and did it without you. So they really loved it. So that's really good. And so a few of the students, it has went on for a few years. So they've been able to have those students together. And I love it when it goes from middle school to high school, because that's a huge transition. And I really love when the schools have really supported that. And you'll be surprised at who's come into these trainings. I mean, we're seeing district superintendents, you're seeing principals. So they're looking at it and they're wanting it. So that's really good. And I think this is one of those programs where you have to say, look what we have, and everybody else kind of wants it. You know what I mean? It's one of those projects. So it's really great. And there's definitely more information. And if you will, we can definitely get you all information on that, because that's definitely something you'll want to know. And I don't know what all the schools are that are doing them, but any school could ask to be a part of this. So that might be something you want to work with your school with. The ABLE Act implementation, is everybody here familiar with the ABLE Act? Mm-hmm. Okay, so the ABLE Act would allow you to be able to save some money without having it count against Social Security. So that's been a really, really wonderful project that Kentucky has been a part of. And so currently Protection and Advocacy is going to be like the clearinghouse for that. We've given a grant to them, and so they're going to be the ones that are going to be giving people information. And so you can do Stable Kentucky, which is a part of, it's actually Ohio's program. So instead of Kentucky spending a lot of money to create their own program, they're just kind of using Ohio's program, which works good. You can do other states. There's other states that do it. You don't have to do Ohio. But Protection and Advocacy is going to be a clearinghouse to be able to help answer questions. And I think, if I'm not mistaken, I'm thinking that grant they were supposed to start soon, so it's probably in the next month or so. But it's great because you can actually save money if you need something, and they can put it. I'm sorry, go ahead.
No, I was just going to mention that part of one of our sessions for our April 22nd after-school special workshop at Taste Creek Christian will be by Karen Perch, and she's going to cover the ABLE Act.
That's really
ABLE
good.
accounts, among other things.
So you can look them up online if you want to look it up. You can look at Stable Kentucky. You'll come right up on it. Kentucky's website from the State Treasurer's Office links right into this. So you definitely can go ahead and be looking at that information. But if you want to have a little more support, ask questions, that's what Protection and Advocacy is going to be doing. So it's a wonderful program. It's really interesting to me because I did training in Ohio with their folks because I just happened to be there. And so parents could invest, like I could put $2,000 for Will, and so could my husband. And it's deductible off our taxes every year. So we could put $4,000 into Will's stable account and deduct that, which is really cool. So, and you can save up to $14,000 a year. So, and it has to be used for certain things. You can't just use it for everything, but it can be like certain living expenses, like if you needed to buy equipment or van repairs, there's a lot of different things that you could use it for. But up until this point, people have not been able to save money.
Is that per child or per family?
That actually is per child. And actually, it's really interesting because you could sign up, each of your children could be signed up, and it's per child, it's not per family. So there's a lot to it, so definitely look into it because there's a lot of interesting little tax breaks and then an opportunity to save money, which we haven't had before. So a little bit about the membership of the council. So the council has 16 individuals and family members, and we try to keep it balanced at a third, usually of people who have disability, and then a third of parents, and then there's another, the last third could actually be either. We always have someone who is a representative that's lived in an institution. Currently, Sherry Sanders has that position, and she just got reappointed, but I think she only has one more year, and so at some point, we may be appointing a person who is a family member of someone who's been in the institution. So, and so they're all governor appointed, and then we also have representation from agencies in Kentucky, which is really good because if we have questions, there's lots of things that we can ask. Like we have Medicaid, we have people in our office, we have Office of the Blind, we have lots of people who can answer questions, and they are really good. Protection and Advocacy. Camille Collins represents P&A, so we have those agencies as well. So, and they serve up to 3 years, and they can serve 6 in a row. So it's really important that really whoever's on the council that they're active, because we're pretty busy. We have 3 work teams and then 3 committees. We have executive committee, we have the council affairs, and then we have public policy, which is mine. If you're on public policy, you are super busy because we are always working on whatever's going on, not just here in Kentucky, but what's going on in Washington. So it's great. I feel like I love my public policy committee. They're pretty dedicated, so good group, but it's really a great opportunity. And anyone can apply for this. It could be an individual who has a disability. It can also be family. So keep that in mind. I was thinking especially with some of the young people as they're coming in as self-advocates, it's really a good opportunity because we love to have people on here. So these are some of the agencies who are on as representatives, and that is DALE and Medicaid. We always have someone from education, public health, OVR. And then right now we have Claudia Johnson. I hope we get to keep her because she's pretty busy, so we're hoping that we get to keep her for a while. Sorry about that. So, other agencies are network members, which is we always will have Protection and Advocacy, and we always will have someone from HDI. So from HDI we have Harold Kleinert right now, who's representing from, I don't know how many of you went to his retirement party, but I was there, and he didn't retire.
I was going to say, how is he still there?
Yeah, he's still there. Yeah, he's still at HDI. So, yeah, he didn't retire. I don't think he ever will. So they're experts in their fields, and they're great to give us information. Recently, we were asking about like petitions, the number of people who petitioned for 202Bs. They were petitioning for opportunities to put their family members in institutions, and we wanted to know that information. Well, we just went to one of our council members and said, can you get us this information? And they just emailed it back to us. So it's very, very helpful when we're trying to get information. Another place that we get information, and I'm pretty sure it's not on these slides, is the Martin School of Public Policy. They do a lot of research for us, which is really great. So right now they've been working on medically fragile, medically complex. We don't really have a definition for that other than in foster care. And so that was been one of the issues with the task force that was looked at being formed this year, is learning more about medically fragile. And so we've had them actually do quite a bit of work for us, gathering information across the nation and across Kentucky about what's out there. And so we thought that would be helpful in waiver redesign, and then also just because we don't have that information in Kentucky in one place. So right now that info is currently in draft form, and Public Policy Committee will be meeting in early April, and hopefully we'll be releasing that information too. So if you look on the council's website, we often have the Smart in School reports will be published on there. There's some already on there. So CCDD is what a lot of people call us. So how do we work? We have a 5-year strategic plan that is based on the comprehensive needs assessment, and it has goals around advocacy, capacity building, and systems change. All the things that they say that we need to do under the DD Act. So, and it's monitored, we're monitored federally to make sure that we are doing the right things. So we do have to track data. So every year we create a work plan. And so we have the 2017 and 2018 work plans, and they have very specific projects in them. And you can't see it, but that's just, we have each group, work team has a goal, and then has all the activities listed under it. So we actually have that, and that's something it's open information anybody can look at. So 2017 public policy priorities was looking at home and community-based services. We know there's long wait lists. There's over 7,000 people on the wait list, but we also have been told that we know that those are duplicated amounts, like the numbers are duplicated, but we haven't seen any concrete numbers yet to be able to say we have this many. All we're saying is we know there are over 7,000 names on wait lists. So, and then we've also are concerned about Medicaid funding, about going to block grant or per capita cap. Then of course we've also got on there, one of the issues is medically fragile or medically complex, employment, and there's a letter missing there, sorry about that, housing and education. And so we have some research going on for medically fragile, actually employment, housing, and long-term services and support. So we have research through the Martin School going on actually all of these. We actually have a charter school report on education. So it's just some great information. It's nice to have the Martin School because they're looking at it more objectively than what we might be. So they're getting us the good information. So, and then we also serve on different councils, and so these are just a few. The Medicaid Advisory Council. And so these are meetings that are open. I mean, the House Bill 144, are you all familiar with that one? Okay, so that's one that you can come to. A lot of people do. Sometimes it's hard to find. If you're interested in going, get with someone who's already been before, so that they, because it's hard to find sometimes. The Community of Practice on Supporting Families Across the Lifespan is a really kind of fairly new project, and it is about tools that families can use to help do some planning. And so we have been looking at that work and have actually had a kickoff at the ARC annual conference, and it was pretty good. So it's really great materials. There's a star and a trajectory, and it really is looking at what your personal assets are. It can look at anybody. It doesn't have to be a person with disability. And then looking at a trajectory of where you want to go and how you're going to get there. What do you want to stay away from? What do you want to go toward? So it's really easy planning tools. I think a lot of times person-centered planning is complicated. And so these tools are really, really easy to use. I don't know if that's something that you all have seen, but it's really good information, and there actually is a website for that too, and I can get that information so that you all can take a look at it. And we're just getting Kentucky's project. We just started that this year. So, and then there's also the Autism Spectrum Disorder Advisory Council. Right now, usually a council member fills that seat, and right now we are looking for a new council member because we just had like a rotation. We had 5 or 6 new members come on. We've got quite a few because the governor reappointed people or put new people on, because we got a few people reappointed and then everybody else was all new. So we're trying to get everybody acclimated, and then we'll have someone signed up for that. So just a little bit about the vision of the council. Remember that we want to have communities that are fully engaged and support and provide opportunities so that every person has an opportunity to live their dream of life, fully integrated, valued, and contributing. So the council's work is really just about giving everybody an opportunity, for helping not just individuals, but also for helping families. And being a member of the council means that you get to do really, really great work. I mean, you really do, because it's an important job, because you get to help decide how money's spent on projects in Kentucky, and that's really important. And then you also get to help work on different policy-related issues. We actually meet and talk about those. It's not, someone doesn't decide all this stuff, it's the council that decides. I'm the support staff, and I help them with whatever things they decide. And sometimes they'll ask me what I think about things, because I'm also a mom who's been through a lot of issues myself. But that's what we do, is whatever the issues are. That's why usually transportation comes up on priorities. And it didn't, because I think because they've tried and tried and tried, and they just couldn't feel like they could get very far with that. So now really wanted to focus on what could we make a difference in. And actually, it didn't come up on the needs assessment as education this year, but in light of all the charter school issues, our public policy committee decided that education needed to be put on. So just to make sure we were looking at it and covering everything. I'm sorry, go ahead.